So my name's Emily. I'm one of the consultants and the clinical lead at Oxford. So thanks very much for inviting me to speak today. I've been set quite a strict agenda. How do I work your mouse? It's very sensitive. So I'll try and keep to time and cover what I was meant to be covering. So Oxford is a big county and we have an integrated sexual health service across 9 clinics, levels 1 to 3. We also have quite a big online self-managed care service, which includes a postal kit service, which is in-house and bespoke. So why am I here talking about sort of online innovation as a doctor? I started my consultant post in 2018 and was given a really small project because we had our tender coming, just to give me some management experience, and that was digital innovation. When the tender spec came out, that small little role suddenly grew quite big because the tender spec was all about self-managed care, online innovation, and remote postal kit testing. So my role suddenly got bigger and I had to learn very quickly. We needed a brand new electronic patient record. We used Excelicare, and it wasn't a great experience. So we had to get a whole new patient care record. In came Andrew and Sue, in the days where they actually came to meetings, not on Teams, with their suitcase and their projector, and they were late, I remember. But they showed us a product that was really exciting and very much in line with how we work in Oxford and the direction of our vision. Over the last 4 years, we've been not only fulfilling our contract obligations and launching the things we have to launch, but also looking at how we can improve pathways for patients and patient care ultimately. So I don't know about anyone else, but it feels like at the moment, working within the NHS, there's a lot of pressures. We have to increase in activity, we have to meet our KPIs, we have to keep our staff happy, occasionally deliver high quality care, all without spending any more money, especially on staff. And that can be really stressful, and you have a couple of options. Also, I think, as Jack said, there's a huge emphasis on digital innovation. But then you have to be careful because that comes with the caveat of don't digitally innovate too much because then you'll digitally exclude the most vulnerable patients. So everything feels like a fine balance. What can we do? We can make our staff work harder and faster and make ourselves really unpopular. Or we can innovate services and streamline pathways. And given this is a digital conference, obviously that's what we're choosing to do. So what can we innovate or digitalize to make our lives as clinicians easier? There's lots and lots and lots of things where you're sitting at a computer going, oh my God, this is so boring. A computer could do this. But I'm just going to focus on results management and notification because that's what I was told I had to do. So what is results notification? Well, when someone does a test, they want a result and they want to be told about that result. I'm going to focus on our postal kit tests today just in the interest of time. So currently, we have an in-house postal kit service that we run within Oxford Sexual Health. So the patient will order their kit via their PHR. Then the kit is dispatched. They get a message via their PHR. They have to then return the kit via their PHR, and then they're waiting for their results. And it's not sort of, you would assume the circuit would be complete and their results go back into their PHR, but we're not there yet. So our current results notification involves, we have some automation. So for example, if somebody does some tests on a day and they are all back, all processed, all negative, they will get a text message sent to them, which says something very vague like, your tests are fine, without anything else particularly, because obviously it's going to pop up on their iPhone. Anything not normal, so whether that's positive or just not processed, has to be manually reviewed by a work list filter and a person. And I'm going to use a couple of case studies just to demonstrate where things go wrong. So this is Jane. Actually, Jane's really happy. It goes right for once with Jane. So she does a screen, asymptomatic screen, And she is completely bowled over by the clinical leadership of Oxford Sexual Health and how efficient everything is, because she gets her results back within 2 days of sending it back, and she's very happy. So why did things go right? We're not used to things going right in the NHS. So basically, Jane ordered a kit. She sent everything back in that kit. Everything was normal, and therefore our results notification kicks in, and she gets her text message, and she is happy. But as we all know, not everyone is happy within sort of NHS care. So this is Sally. Sally, they're all women because the screenshots were of vaginal swabs, but I'm not being sexist. Sally's had a very, very busy week in Freshers' Week. She's had loads of fun and she's really tired, and she's going to go home to see her pining boyfriend who's been missing her. And she thought she'd better just have a screen just so that she's not infecting him with anything. And she doesn't hear anything back, so she assumes no news is good news, right? But unfortunately, Sally has gonorrhea, and she hasn't had her results yet because when something is positive or not normal, it interrupts our negative to bulk text rule. And it needs a manual person, one of our lovely health advisors, to sit through the list, manually review the results, and send the message out. The problem is, with massive increases in gonorrhea and syphilis and everything else we're facing, that list is getting longer and longer and longer without any more staff. So patients are then having to wait for a longer time to be told they may have gonorrhea whilst they're having sex with other people and spreading the gonorrhea. So Abby does not look happy. So Abby is not happy. She's really anxious. She's got a background of mental health issues, and partner's cheated, and she's done a postal kit, and she's desperate for the results. And it's been 10 days now, and she's spiraling, thinking, they're holding it back because I've got syphilis, I've got HIV, and she's really, really panicking. So what's happened here? Essentially, nothing's positive, but she didn't fill the blood up enough. So this is something we get a lot in Oxford. So one of the tests isn't processed, so that then holds back the results processing rule. It's not that she's positive, it's just that somebody has to go into that list to manually review it. And you can imagine with increasing levels of gonorrhea and syphilis, the positives have to come first. So these low-risk negative but waiting come last, and that can be a longer wait. And what happens is worried patients get cross, and cross patients ring, and cross patients complain, and that puts more stress on patients, on staff, and for me and my senior team, more painful commissioners' meetings when we're looking at our KPIs. So what can we do? Well, obviously, we reach out to our partners, Inform Health, and we talk to our amazing client manager, Vicky, and we say, oh my God, please can you help me with this problem? I need an innovation, a digital innovation. So she talks to the techie team who go, oh yes, I think we can do this. And then we get a quote from commercial and we go, oh yeah, we can probably do this. And then we do design and testing and refining. And then everything's signed off in UAT, which you have to do really carefully. Otherwise you get boxes in the wrong place where you don't want a box. And then it goes into the development cycle, which no one really knows what the development cycle is, but it's about 3 weeks. And then at the end of that 3 weeks, you get a product. And this is our product that we are soon to have. It's called the Results Notification Module. And in the interest of time, I'm going to just show you a couple of the features that hopefully, and I'm promising my colleagues, will make their lives easier. So negative results. So we know from Jane, she was happy with the service. She was really happy that she got her results back and they were fine. But actually, we do get quite a lot of feedback from patients saying, this vague message, your tests are fine. What tests? What tests did you test me for? And did you get them all? And it came back really quickly. Was it really my results? And they ring up anyway, asking for negative results. What did you test me for? Was it all okay? So actually being able to see the tests that the patient has is really important. So what we're going to have is the patient will, if their tests are back and negative, they will get a message sent to their PHR telling them that the results are available and they can log in to see the results. In the interests of sort of not spending too much money on text messages, we will choose to just send an email notification because we're not as bothered about people reading about negative messages and we don't want to waste money. And the most important thing, well, not the most important, but one of the important things when you're sat at a management level is the KPI tick box. So this patient was informed on this date of their results. So everyone's happy. With the positive results, again, this is something that we haven't got at all in Oxford at the moment. Every positive result is manually reviewed, and that can take a huge amount of time. So with the positive results, we've got a few more safety nets, because you want to be careful that you're not informing somebody of a positive result who doesn't want to be informed in that way. So we've got safeguarding checks first. So if they're over 15, no vulnerabilities, and have the correct permissions in their PHR, they will get a message telling them to look into their PHR, because again, you're sat in a meeting, you don't want your phone pinging up going, "Hello, you have gonorrhea." You want to be able to prompt to go, "I need to look into my PHR record." And also it comes with that extra layer of logging in and security with your results and your tests. Then the patient does get a message within the PHR giving details about the infection and also about some safety netting in terms of please don't have sex with anyone until we've organised to have you treated. And we want to build on these modules. So, for example, the results, the appointment invitation. If the health advisors have sent this out, then they can invite them to book treatment, and it takes out a lot of voicemails, calling, messages, calling back, all that manual stuff that takes so much time. And importantly, we also have the ability to see when they've read the message. And I think for the health advisors and partner notification, knowing we have notified them, they have read it, does help with our partner notification KPIs. When you take away tasks that are mundane and boring, it frees up time for staff to manage the more complicated things that need clinical interpretation. So if we look at our to-do list, we've got our negative results largely catered for. We've got our positive chlamydias and gonorrheas largely catered for. Obviously, you're not going to tell someone with HIV that they have HIV via the PHR. Things like syphilis, serology, candida cultures, those kind of things that need clinical interpretation need to be interpreted still. But the staff who are not doing all the mundane bits and pieces have more time to do that, to focus on it. And also the unprocessed ones, the ones that sit at the bottom of the pile, can be looked at more quickly because everyone has a little bit more time. So I was asked to finish on an inspirational sort of closing statement. So I reached deep and have come up with something. Obviously I've worked with Inform now for quite a long time, 5-6 years, and it has been a journey of challenges, excitement, rewards, investing in a sustainable digital innovation. But that's not really me, or Inform from what I have known of them. In reality, my inspiration is my badass boys, and working with a team like Inform you feel supported. They understand the challenges of what we're all trying to do, and they support you, whether or not it's, if it's just something you really need help with, they're always there to listen. And I think the innovation that they present, especially today at these conferences, is really inspiring and gives me hope for the future. So that's it. Thanks very much. Probably gone over. No time for questions.